Hello guys, welcome to a new topic about amyloidosis. So let us clearly understand what is amyloidosis. So here the definition is misfolding of protein accumulation in extracellular space is nothing but in between the two cells there is an accumulation takes place. So here is nothing but, so why, even though there is an extracellular accumulation, then why it need to a death of a cell? Let us come to etiology of the necrosis. Here there is an accumulation of this some protein like amyloid we are talking about. It's nothing but like a amyline is nothing but a carbohydrate, but it's not a carbohydrate. Its look appearance will be as in carbohydrate, so the name is given as amyloids. And here whenever there is a protein accumulation between the cells, there is a compression takes place and leads to a cellular damage, gross appearance. So it nothing but staining with iodine, it leads to a magonghy brown color appearance, and along with when you add with the sulfuric acid, it colors a blue color. What is a microscopic view? Microscopic view is nothing but on hematoxylin and eosin, eosinophilic amorphous and hyaline like appearance. This is major, should be underlined. Then special stain is nothing but Congo red. So and here you can be clearly differentiate into two types here also. One is about light microscope, red in color, and polarized light, which is the best MCQ. Apple green bifringes. Whenever they are given any clinical case, you should apply this apple green bifringes about amyloidosis. Next, others. So these are having a less important when compared to Congo red stain. These are methylvalinate, thioflavin T and thioflavin S. Next. So what is physical components of amyloid? So physical components of amyloid is nothing but, so here the majorly it is divided into fibrillar part and afibrillar part. Fibrillar part and non-fibrillar or afibrillar part. Fibrillar part is nothing but which is generally, so the amyloid is nothing but protein when a physically stained appearance. Here it is a protein-like structure having about the distance, the diameter is about 0.4 millimeters. Whereas we cannot clearly distinguish the length. The length is infinite. It can be grown as long as it's possible. So these protein-like appearance, they are divided into different forms. As in case of AL, in case of multiple myeloma. In case of multiple myeloma, there is a light chains. Light chains are accumulated. These known as AL, amyloid as well as light chains. What is AA? Is nothing but amyloid is associated. What is associated? Associated is nothing but, so it can be not with a direct thing, but whenever a disease caused, there leads to a SA protein from liver. So this associated protein is nothing but secondary amyloid associated protein released from this liver, which leads to cause an AA amyloidosis. ATTR is nothing but the one of the best thing is TYRITIN. So what is this? Transport thyroid compounds as well as retin. There is nothing but retinol compounds. So this is all transported by trans-tyritin, nothing but the name itself we can clearly differentiate about ATTR. Next, A beta 2. So generally every student will be confused about A beta 2 as well as A beta 1. So we can clearly examine in A beta 2 there is two kidneys. Whereas in A beta is nothing but only one brain and kidney. So here A beta 2 is nothing but beta 2 protein, beta 2 macroglobulin, which is accumulated, beta 2 macroglobulin which is accumulated in case of hemodialysis patient. Every protein can be passed out, but not this beta 2 macroglobulin. This accumulation will lead to amyloidosis. A beta, which leads to another form of beta protein which called Alzheimer's disease. algemestosis. Endocrine amyloid hormone is precursor protein is nothing but it related to any type of hormones like such as a prolactin, a calcitonin, like this. Next, APPR is nothing but prion dependent protein. Prion is nothing but it's a viral protein which didn't have any nucleic acid compounds, only proteins are present. Non-fibril part, it's not about less important like glucosaminoglycans, apoprotein E, which is used for a HDL transporter as well as component of P component of the protein as well as another etc. are present in case of afibril part. But everyone should be total clarity about this fibril part than about non-fibril part. So then comes to a next. So physical components of amyloids. So what is this physical components? So then later, classification is divided into systemic amyloidosis as well as localized amyloidosis. Primary, already I said about multiple myeloma, and secondary amyloidosis. A is nothing but in case of other like I already said about SAA. Hemodialysis A beta in case of kidney hemodialysis by dialytic machine as well as heterofamilial. So here you should be clear about hereditary polynephropathy TTR. So here is a type of A is associated protein as well as a rare hereditary forms endocrine mediated. It may be like calcitonin or parathormone, like this. Then localized amyloidosis. So this is nothing but which can affect everywhere different parts of the body, not only a single part. Like in case of multiple myeloma, it leads to a kidney as well as accumulation. This leads to a necrosis. It's like systematic part, not only a particular organ. It can leads to in different organs, whereas in case of localized amyloidosis it only particular to that place, like senile cardiac, which is a deficient of TTR is nothing but transthyretin, amyloid transthyretin, senile cerebral A beta, and its APRP is nothing but prion protein, endocrine is prolactin and proinsulin, whereas tumor forming is nothing but it's an example of AL. So let's visualize this classification, then later on come to another topic. Next, pathogenesis. So what about the pathogenesis? How the cause of this? So okay sir, you explained clearly about what are the different accumulations, what are the classification. But okay, then if these are present in a higher core, then what about the disease that is causing? So here the pool of excess of precursor protein, like we already discussed about AL, AA, ATTR, APRP and ACAL. These are nothing but precursor proteins. These are already formed and reversible misfold and aggregation. This leads to aggregation in various parts of the body. It may be aggregated in case of, like, take it an example of multiple myeloma. In multiple myeloma, this AL chains is nothing but kappa and lambda chains. Kappa and lambda chains. Lambda chains are mostly accumulated in kidney. These are nothing but excess precursor protein and misfold and aggregation of these proteins takes place. Then non-fibril components, along with whenever there is accumulation of these proteins, then ever another afibril parts. What are the non-afibril part? Let me guess, like P components, apoprotein E, and like others we already discussed, glycosaminoglycans, like this. So here this is the major concept about pathogens of amyloidosis can be takes place. Then next, organs and site of accumulation. So everyone, please take a screenshot of it. You can clearly distinguish where the organ and site where there is an accumulation takes place. Like kidney in case of mesangium, heart, subendocardium, blood vessels, endothelial cells, in between the endothelial cells, whereas liver. So liver is nothing but space of this. So what is this, sir? Is nothing but generally there is an arrangement of hepatocytes in case of hexagonal patterns like cords. This is, and space between them is nothing but DC. Here when there is accumulation takes place, this leads to compression of these components, which leads to liver necrosis. Spleen and red pulp. So in case of spleen, it is divided into two types again: sago spleen and lardaceous spleen. So lardaceous spleen is nothing but, the name indicates, shit of a pig, or nothing but a large portion like world map. World map. So it is majorly takes place in red pulp, whereas in case of spleen with white pulp, it may takes place by sago spleen. What is sago spleen? Is nothing but here, generally in the spleen structure, we can observe a whitish follicles on the periphery, whereas reddish is nothing but red pulp. This white pulp leads to, there is this accumulation leads to a nothing but sago green appearance throughout this spleen. So this is sago spleen. And skin is pinch purpura. So because of this, we already discussed about endothelium. Then whenever when a touch or any pinch takes place, they lead to a reddish color appearance, is due to the breakage of the endothelium. Breakage of the endothelium cause the blood release and leads to red color appearance, JAT. So everywhere in our body, when there is, sorry here, megale, everywhere, like tongue is leads to a macro tongue enlarged, and in case of like liver also enlarged, and other organs such as splenomegaly, and so on. In every organ leads to a megale condition, is nothing but increase in the size. Joints. So is nothing but, we are clearly explained about tendons and all. So there is in this joint accumulation, like the entrapment of flexor sheet of hand leads to a median nerve entrapment, causing a carpal tunnel syndrome. So this, next go to other. So integration, amyloidosis cause absorption of the factor 10, causing bleeding. So as we already discussed about pinch purpura, there we have discussed about the factor 10, why the blood is accumulated, is nothing but the factor 10 causing the bleeding of this whenever there is a pinch or touch takes place. Diagnosis, abdominal fat aspiration is more than rectal biopsy, is nothing but amyloidosis in case of fat aspiration is clearly takes place from the abdomen, not from the rectal, because rectal complication will be there, like anal bleeding and so on, like mucus secretions, such there is many complications will be take. So we should take fat aspiration is more preferable when compared to the rectal. Next, so here, as I have already discussed in previously, what is the pathogenesis. Amylogenic intermediate is misfolded proteins, and along with this we can clearly observe a components of the afibril part components are conjugated, leads to formation of the fibril. So fibril parts is nothing but, whereas in folding leads to fibril part, whereas in case of acquired mutations, plasma cells, immunoglobulin, A light chains. So here we can clearly what is associated proteins without with interleukins 1 and 6. B lymphoid proliferation leads to form AL proteins. So generally plasma cells leads to form an antibodies. If there is a defect in the plasma protein, then leads to a defect called AL protein deficiency, is nothing but amyloidosis. Inherited mutations. Mutant TYRITIN. TYRITIN is a protein which transport thyroxine as well as retinol, which leads to ATTR accumulation. Here a diagram. Whenever a kangaroo red is given in light microscope, you can clearly observe an amyloidosis appearance like here. So it appears as a reddish appearance in case of light micro. Whenever we takes into polarized light, polarized, we already discussed apple green bifurcations are clearly observed. So this is the main case of amyloidosis. So this is all about amyloidosis. Keep watching. Thank you.